This video introduces the MidStream Urine Collection Set, designed to collect a clean, uncontaminated urine sample from the middle portion of the bladder's flow. Key benefits include minimizing contamination and ensuring diagnostic accuracy for optimal patient care. The product features three main components: the integrated funnel attachment for clean collection, the collection tube for sample preservation using boric acid, and a red closure cap with a secure, leak-proof inner seal. The set stabilizes samples for 50 hours, maintaining high viability for 10 hours. The procedure for use is simple. Step 1 is preparation, where you remove the cap and attach the tube to the funnel. Step 2 is collection. Urinate normally, without pausing, to capture the midstream sample. Step 3 involves detaching the specimen tube and securing the cap. Finally, dispose of the device as instructed in Step 4. This system features dual mechanism protection. Mechanical exclusion via the funnel rejects the contaminated initial stream, isolating the pure midstream sample. Chemical stabilization with boric acid prevents baseline organisms from multiplying during transit, preventing false positives. The kit extends sample viability without refrigeration. Unpreserved samples must be processed within 2 to 4 hours due to bacterial overgrowth. Boric acid stabilizes the sample for 24 to 96 hours at room temperature, which is essential for off-site clinics with delayed courier pickups. Boric acid preserves cellular integrity. It maintains the overall sample integrity by preventing cell degradation, protecting white blood cells and red blood cells from lysing. This is vital for diagnosing pyuria and confirming an active immune response. The set maximizes cost savings by reducing costly contamination. High contamination rates in primary care lead to expensive repeat tests. The combined mechanical and chemical preservation drastically reduces ambiguous results, slashing labor and media costs. The system supports accurate antibiotic stewardship. Contamination in standard cups can mimic severe infections, leading to unnecessary broad-spectrum antibiotic prescriptions. This system ensures that positive cultures indicate a true urinary tract pathogen, allowing for targeted, narrow-spectrum therapy. Traditional MSU collection presents challenges. It has a high vulnerability to contamination with rates between 20 and 30%. Anatomical barriers, especially in women, make it difficult to prevent skin flora from seeding the sample, leading to obscured, mixed-growth lab results. The clean catch technique is challenging for patient coordination, requiring high physical dexterity and precise timing. The manual interruptions needed to capture the mid-portion are difficult for the elderly, heavily pregnant women, and pediatrics. Traditional MSU collection often results in a negative patient experience and significant hygiene concerns. Direct spillage onto hands, clothing, and restroom floors creates a biohazard. Wet container surfaces can also lead to labeling failures and clerical errors. Standard MSU collection can lead to misdiagnoses or false negatives. Dilution from high fluid intake can push bacterial concentrations below diagnostic cutoffs. Furthermore, intracellular pathogens shed in lower numbers can be missed by routine cultures. False positives due to delayed transit drive poor antibiotic stewardship. Transit overgrowth of harmless skin bacteria mimics severe infection upon lab analysis. This prompts clinicians to prescribe unnecessary broad-spectrum antibiotics, driving global antimicrobial resistance. Boric acid provides essential preservation for urine samples, ensuring diagnostic accuracy and clinical efficiency. It offers bacterial control by preventing overgrowth and extending viability to 24 to 96 hours. It also preserves cellular integrity, vital for diagnosing pyuria. However, boric acid has cons and disadvantages. Technical barriers require a strict 1% volume ratio, and it is incompatible with dipsticks. Biological limits include pathogen suppression that can mask delicate infections. There are also safety risks, as it's toxic if ingested, leading to higher procurement costs. Boric acid is a cellular toxin causing acute and chronic toxicity, especially if ingested or inhaled. It is rapidly absorbed through the GI tract and damaged skin, concentrating in the brain, liver, and kidneys. Over 90% is eliminated unchanged via urine, with an average half-life of 13 to 27 hours. Acute toxicity symptoms generally manifest within 2 hours. Gastrointestinal issues include nausea and vomiting, with stools potentially being blue-green. Dermatological signs involve a lobster red rash and skin peeling. Central nervous system decline can lead to seizures and coma. Renal and systemic failure can cause metabolic acidosis and acute kidney injury. Chronic toxicity results from long-term low-dose exposure, leading to gradual accumulation. Clinical features include alopecia, severe anemia, and systemic weakness. Vulnerable groups such as pediatric populations and those with renal impairment are at higher risk due to lower body mass and impaired clearance. There is no specific antidote for boric acid. Treatment is supportive. Immediate decontamination involves flushing eyes and washing skin. Gastric lavage has selective utility if ingestion occurred within 1 hour. Hemodialysis is the gold standard for severe symptoms or renal failure to clear toxins rapidly. A 1-gram dose of boric acid in the MSU tube is completely safe. As a preservative, it remains inside the tube, resulting in zero systemic absorption and no risk to the fetus. The preservative never touches internal mucous membranes, preventing it from entering the bloodstream. Fetal toxicity risks are limited to extreme systemic internal exposure, far exceeding diagnostic use. Warnings primarily apply to large-scale ingestion or high-concentration use, not the brief contact in the collection tube. The adult lethal dose is 5 to 20 grams, well above the 1 gram in the tube. Patient safety protocols are essential. Do not open the tube or ingest the preservative. If spilled on hands, wash thoroughly with soap and water, as it does not easily penetrate healthy skin. Keep the kit safely out of reach of children or pets at all times. Thank you for watching this video. For any inquiries or questions, please feel free to reach out to us at tetramedex@gmail.com.